Let's discuss this further. Benjamin Newman is a professor and the chair of biological sciences at Texas A&M University. He joins me now from Texarkana in Texas. Mr. Newman, thank you for taking time to speak with us. So the Centers for Disease Control and Prevention just released a survey saying that coronavirus cases in the U.S. could be as many as 24 times higher in number than reported. Does this surprise you?
No, this is just basic arithmetic. Right now, across the U.S., most places are showing about a 3% case fatality rate. So 3% of all the people that test positive are dying. But we think, based on more widespread studies where they go out and proactively test people, that the real rate is closer to 0.3%, which means that we're getting about 1 out of 10 cases. And so, yeah, it should be about 10 times as high as the number we have now. And you can get to that number by modeling or, like I said, just simple arithmetic.
And strangely, we're seeing more people not wearing masks while they're out in public. Why aren't people taking the virus as seriously as they should?
I hate to say this as a scientist, but it's become a party political issue by the look of things. There are a lot of people that seem to conflate the idea of mask wearing with the idea of the Second Amendment, your right to have a gun and form a militia. And I think the idea is that it's a slippery slope between someone making you wear a mask and someone taking your guns. It sounds absolutely insane to articulate it that way, but I think that is part of what's striking a chord with a lot of people. They just don't like to be told what to do, even when it's absolutely the right thing to do and completely necessary, as it is in this case.
Well, Mr. Newman, health officials have confirmed COVID-19 is disproportionately impacting people of color. Is this a case of economics, biology, or why?
As far as we can tell, there is a greater impact, and at least part of this is going to be due to access to health care. So there are people of color who are being treated differently than other people, and they're resulting in higher rates of death. Now, the higher rates of spread may be due to more testing within actual communities that have some cohesion, which some of these communities that you're talking about would have that. There is actually higher mask wearing and generally higher awareness. It could be related to that. There could also be some genetic factors that are thrown in there, but we don't know of any of those yet. Right now, it appears to be access and perhaps crowded conditions, and the people who most need to go to work right now are the ones that are getting hit the hardest with coronavirus. And so it's not just people of color, but low-income families in general that can't afford to sit out a lockdown or stop working at all.
Well, top officials are also admitting that the only effective way out of the pandemic is with a vaccine. At what stage are we with finding one?
There are a lot of things in progress. I think the nice thing is that we can actually get out of this without a vaccine. You've got countries like New Zealand that have driven the virus to extinction without the help of a vaccine, just with public health measures.
Well, I believe they had one case within the last couple of days.
Yeah, and it's going to be a matter of continued vigilance until the virus is gone from everywhere in the world. Yeah, any sort of travel is going to turn up extra cases, and there may be those 1 or 2 on the fringes. But yeah, these can be stopped. Most of the vaccine trials that have been out have not released much data yet. We have a little data from one of the Chinese trials and a couple of the European trials. Most of the American trials are being funded but have not yet reported what they're doing, which is somewhat concerning, but it may just be that we're a little too early in the process to actually find out what works and what doesn't.
Right, Benjamin Newman, phenomenal getting your professional perspective. Thank you so much for taking the time to speak with us. We appreciate it.